by May 15, the numbers have been going down. I think the 7-day average has been around 6,600, 6,700. It's certainly been improving. If everything continues on this trend, what are we looking at on that very crucial date, on May 15?
Yes, Robbie, you're right. Yung 7-day average for the entire country is right now nasa 6,500 na lang. And a month ago, this was over 10,000. So some people may feel like no, parang hindi nagdi-decrease yung cases or medyo flat, but actually it's a significant decrease from the 10,000. And also for NCR, our average now is less than 2,000 cases per day. In fact, it might be less than 1,900 7-day average as of today. And yung peak natin, 5,550. So that's a significant decrease compared to the peak. So yung reproduction number natin is around 0.62. Wow. Positivity rate natin, 13%. It might be down to 12% by the end of the week. By next week, baka nasa 10% na, which is acceptable. Ideally, syempre 5% or less, pero 10% is okay. At least it means now our testing is now sufficient. And then yung hospital utilization, bumaba na rin lahat. So less than 70% at least for ICUs. Though medyo mataas pa sa ICUs, that's the caveat. Pero everything is looking good. And yung sinabi mong options, they're all on the table. I mean, there's may mga iba calling for an extension only because it would be I mean, in terms of public health, parang sure na mapapababa pa natin yung cases if we extend MECQ. But it's also possible na we could move to a GCQ or we could extend MECQ pero we ease restrictions. So all three are actually on the table. So babata na natin sa national government, which and of course the Metro Manila Council. Ako personally, I would recommend na if we ease restrictions, it should be gradual and calibrated. And also, ako personally, I favor keeping the bubble intact muna for now, even if we ease restrictions.
Because Prof, gusto kong bilugan yung sinabi mo. Did I hear right? Reproduction rate is at 0.62?
62.
Yes, it's 0.62.
That's the lowest this year in a lot of in so many months. Correct?
Yes, it's the lowest this year, and yun nga, we're averaging 1,900. And I checked, and to be fair, nung September, or actually late August last year, when we were already when we moved from MECQ to GCQ, we were still averaging 2,000 cases per day. Pero napababa na rin natin yun. So, I mean, that can be used as an argument for opening up. But of course, medyo iba yung situation ngayon. We're also dealing with variants. And then
yes, how much of a threat is the Indian variant that has now been confirmed in 2 cases?
Well,
Father
of course,
yeah,
of course, there's a real threat with the Indian variant because, as we know, it's a very infectious variant. But we don't know naman if it's prevalent or if it has spread in the country. It's possible na pumasok siya, but the people were under quarantine and they might not have spread it. So we're not certain yet. So we can't say it one way or the other. But what we're seeing based on the numbers, kung kumalat man siya, it's right now being controlled right now, or hindi siya kumalat. So right now, we're not overly concerned yet about the Indian variant. Again, if we're starting to see spikes in cases, and we're seeing spikes in cases in other parts of the country, hindi sa NCR, like in Puerto Princesa, there's a surge. We haven't seen a surge in Puerto Princesa in more than 1 year since the start of the pandemic. Ngayon, nagkaka-surge sila. And then Cagayan de Oro, Bacolod, yes, and Zamboanga City, medyo mataas ng case loads sa Zamboanga City.
Father, let's put it this way: should we loosen up restrictions in 4 days, by the 15th or by the 16th? Given the fact that number one, you still have the Indian variant hovering over the horizon, and number two, all this is premised on whether we have all the proper elements in place: a good healthcare system, a good contact tracing, and so on down the line. Should we, from your perspective, Father and Dr. David, should we loosen up the restrictions?
Well, I think our response is gradual opening up is reasonable. Now, the question is, what is gradual? And that is going to be what the government has to calibrate based on contact tracing, because we know, for example, in Quezon City, that they are training, the new contact tracers are being trained now. It will take a week or two. So they will be deployed out in the field probably next week or the week after. So can we wait until they are fully deployed? Certainly. Will it hurt to open it up a little bit? Again, we're going to have to open up, because we're not going to, the vaccines aren't going to help us until the third or fourth quarter. So either we're going to stay this way for the next 6 months, or we're going to have to gradually open up and test our current system. So gradual, the danger is we open up too quickly, we underestimate the force of that virus and it explodes.